A close call on Monday after some hospitals in the state announced they could no longer take appointments for early detection breast cancer screenings after the U.S. Department of Health and Human Services waited until the very last second to notify states that funding would be renewed.
Grant Green has more tonight from one cancer prevention advocate on why this scare is not acceptable. Hello, Grant.
Good evening, Brian and Andrea. For almost 30 years now, states have received money from the National Breast and Cervical Cancer Early Detection Program, which is administered through the CDC. Money comes through every quarter, and it's critical for the hopes of detecting cancer and extending lifespans for over 1,500 women in the state.
In South Dakota, money goes to the All Women Count program once a quarter, which serves women who are either uninsured or of lower income. Through the program, women can get access to pap smears and mammograms, but on Monday, hospitals around the country didn't know if they were going to be able to schedule appointments for these services for quarter 3.
Early screening save lives, and stability in programs that provide those, especially for the most vulnerable, the lower income or folks who don't have health insurance. It's critically important for them at a crucial moment in their life that could be the thing that extends their life, depending on their age, 30, 40, 50 years.
Ben Hansen says North Dakota's health department planned to get rid of 4 state employees before the federal Department of Health and Human Services announced that funding was coming.
But as you can imagine, for workforce retention, that probably doesn't create a lot of confidence in those employees. So we're concerned about all those things. We're concerned about disruptions in healthcare and services. Early screenings have been proven time and again to be the #1 way to combat a fatal outcome from a cancer diagnosis.
Going forward, it's not immediately clear if South Dakota will receive the same amount of money as they have in previous quarters.
And we have been in contact with South Dakota's Department of Health and are currently awaiting their response on what transpired. Brian.
Grant, thank you.